Hello, everyone, and welcome to Arthritis at Home. My name is Ellen, and I'm the program's coordinator. Today, we are joined by Dr. Teeter, who's an associate professor in the Department of Medical Biophysics, Medical Imaging, and Surgery at the University of Western Ontario. Dr. Teeter also leads a research program that aims to enhance patient mobility and quality of life after joint replacement surgery. And more recently, he won the STARS Career Development Award from the Arthritis Society for work in that area. Now, with that, please join me in welcoming him to our program. And to Dr. Teeter, thank you for joining us today.
Thank you very much for having me on, Ellen.
Dr. Teeter, can I ask you to tell us about yourself, perhaps your research, and how you're involved in rheumatology?
Yeah, so essentially my training is as an imaging scientist. So a lot of what I do is looking at ways we can actually quantify or take measurements of what's going on inside joints over time in patients before or after they undergo joint replacement, so at the advanced stages of osteoarthritis, using tools like X-rays, CTs or CAT scans, and MRI.
It's incredible. And through this work, you explore something called biological factors. What are biological factors, and how do they affect, for example, surgery outcomes?
Yeah, so biological factors are sort of a subset of patient factors, and we can relate them to, in terms of joint replacement, to implant factors and surgeon factors. So implant factors are the design of the implant, its materials, which might affect how well it's going to survive in the body or wear out over time. The surgeon factors are, how the surgeon chooses to put the implant in place. And then the patient and biological factors are basically how you as a patient are going to respond to having that joint replacement. So how good is your local bone quality that's going to maybe be relying on to grow into the implant, or how reactive is your body to the particles of wear that might come off the implant over time, and are you maybe metal sensitive, or do you going to have reactions to them, things like that. So these are all factors which can affect the success of joint replacement. And really, it's something you want to understand how all these factors work together and make sure patients have really long-lasting implants that restore their function and alleviate their pain.
Absolutely. So, it's really incredible that you're able to collect all of this. We call it data as scientists, but really all this incredible information that will help us tailor, the treatment for patients. Can you tell us a little bit about how you are able to actually, like you said, image or examine? What kind of tools do you use to look at these factors? In this case, gut bacteria. How do you look at gut bacteria?
Yeah, so our tools have become fairly advanced in terms of imaging to let us see what's going on inside the joint. So there's a lot of work we've done, in particular using a specialized X-ray technique. It's a long word called radiostereometric analysis, or RSA, which basically allows us to look at how the implant moves within the bone over time. And there might be a number of different factors which affect that. And one we've become interested in is the gut microbiome, or the bacteria that live in all of our intestines, because those bacteria can affect how nutrients are absorbed across the gut and affect growth factors around the bone that are going to affect how well the implant's going to be implanted. So to measure that, it's kind of a strange thing for us in orthopedics, but actually we have to look at the patient's poop. And basically, you get a sample of used toilet paper, and other scientists in the lab can extract the DNA from the bacteria for that, and basically look at all the different bacteria that are living inside your gut. And then we hope to be able to kind of correlate that to the implant fixation we measure on imaging and see, are there some patients who have certain types of bacteria which are better for bone health, or maybe worse for bone health, or maybe more at risk for implant loosening.
Yeah, and for our audience, I think, even though we know, and we absolutely, the research there supported that having a joint replacement is 100% the gold standard of treatment, there are, in certain cases, unfortunately, and correct me if I'm wrong, Dr. Teeter, where it doesn't work out so good. And we really do want to improve that. And the way to do it is to look at different things, like what else is going on? Why isn't this individual doing really well with their knee replacement, hip replacement surgery? and to be able to look at gut bacteria. And I know it sounds like a stretch, but there's more and more research to say that, what goes on in our gut, those bacteria have so much to do with our cognition, our mood, so much to do with the chemistry in our body. So to know that you're doing it in arthritis, man, I'm so excited to see what you find.
Yeah, absolutely. I mean, you're exactly right. So I mean, joint replacements are basically our best tool now when we get to those advanced stages of arthritis. And the great news is that over the years, they've become really, really good. And we're expecting implants to last so long. And there's 150,000 Canadians every year getting hip and knee replacement. But because there's so many people out there who need this, even if a small percentage of them have some sort of complication, that adds up to a lot of people with a lot of pain and suffering and real impact on our healthcare system. And we have to start looking more and more at the subtler things that might be different between people about why we might not be so successful, including things which seem even as strange as the bacteria in our gut, which might be a signal or something we can modify to help people get better outcomes. And so, it's something as scientists, you never want to say never. You want to look and see what might be affecting things. And there's actually some good evidence for it. And we hope to kind of show this more clinically over the next couple of years.
Yeah, absolutely. And I love the progression in research where before it was, blood tests, blood tests, blood tests. That was how we looked at things like, how's the body doing? Blood tests. Now we look at gut bacteria, and not to say that blood tests aren't important, but to say we're trying to get we're painting a more comprehensive, more holistic profile of what's going on is just so cutting edge. I'm just very, very, very much so looking forward to this project. And with that, Dr. Teeter, from your perspective, do you have any, for example, insights, resources to help improve a patient's disease journey, especially if this individual, for example, is one of those individuals who had some sort of joint replacement surgery? It may not be doing so good.
Yeah, it can be difficult if you're in that position as a patient, and that's one of the reasons we want to work in this area, because we don't like seeing that. So as you kind of alluded to, that there is a subset of patients who don't seem to do as well, and that's one thing to note is there's up to 1 in 5 patients are less happy after knee replacement. They think something's not quite right. And one of the other areas our lab is looking at is patient expectations. So making sure that going into the surgery, you kind of have the right expectations about what the outcome would be. So certainly you want to talk to your surgeon and make sure you kind of understand what kind of outcome you can expect to have. But if you think you've gone in with your eyes wide open and have very realistic expectations, and you've come out the other side and there's still something nagging at you, definitely it's something you want to share with your surgeon. And it's also something we've seen over the years where maybe you want to go to a second surgeon or kind of get some other feedback, because you kind of want to see more about it. That can definitely be a good tool. So there unfortunately still are patients who don't do as well, and that's definitely something you should recognize, and don't be told everyone does well, because it's not true. You might be one, unfortunately, that subset, and being an advocate for that is certainly something to think about, and kind of understanding what that might be, and getting in there and working on it. If you've done everything from your side, from the rehab and expectations part, then maybe it is something to look for, because a small percentage of the time there is a problem, and there can be good solutions for you if it's recognized in time.
I think that's so important, that the points that you gave us, right? Number one, expectations, right? Don't have unrealistic expectations, right? And understand that there is work that needs to be done. Like you said, rehabilitation is work, and following through with the process of rehabilitation requires consistency and commitment. But at the same time, it's also okay to advocate for yourself. It's also okay to seek a second opinion and to acknowledge, if I am one of those individuals who perhaps didn't fare as well, right? Then you're right as a patient at that point to be able to speak up and to make a point of that. So thank you so much for those 3 very actionable and very well laid out insights.
Absolutely. So if we can bring it back to the other topic of today, trust your gut as the patient. So there may be gut bacteria that is going to affect your outcomes, but also what you're feeling about yourself, that's what you need to act on.
I love that. Trust your gut. With that then, Dr. Teeter, do you have anything else, last words to share with our community? Anything else you would like to talk about?
I'd just like to acknowledge the Arthritis Society for giving the opportunity with this research funding, which we hope to put to very good use, and hope to make a dent in those number of sub-patients who are having poor outcomes. We hope to have even fewer of them over time and achieve even better things for everyone who's getting joint replacements.
That's incredible. And once again, thank you to our audience. Thank you, Dr. Teeter, for joining us. And with that, we hope everyone joins us on our next episode of Arthritis at Home. With that, goodbye and have a great rest of your day.